And good morning. Welcome to everyone to Leading Age Services Australia's webcast, which is looking this morning to provide an overview of the 2018-2019 federal budget, which in particular will include our CEO, Sean Rooney, providing an in-depth analysis of the budget and what it means for providers of aged services, their strategy and their operations. Just to start, I really want to encourage you that if you do have questions that come up that you'd like to ask during the webcast, please write down your questions and we will have some time as we go through to engage in a discussion with Sean to look at those questions and provide some feedback to you, which will help to make this webcast better tailored to what your needs are at this particular time. I can also announce that the Minister of Aged Care, the Honorary Ken Wyatt, he's also given us a video that we'll be able to play today. So without any further ado, I'll just hand it over now to Sean, our CEO, and who will take over from here.
That's great. Thanks very much, Troy, and thank you everybody for joining us here this morning. It's fair to say, aged care and ageing featured heavily in the budget announced on Tuesday night. And the purpose of today's presentation really is to provide our members with just some key insights into the initiatives that were announced, but also talk around some of the gaps and some of the questions arising from the budget announcements. What we'll do is a series of slides that we'll go through, as well as have, as Troy mentioned, a short video from the Minister. I've been in contact with the Minister's office all this week and we've been able to secure, straight from the Minister speaking directly to our members, an overview of the budget. But at the same time, I put to him a series of questions that I thought would be of interest for our members. And so in the video, which we'll play shortly, you'll get some commentary from the Minister around things like ACAR, also around some of the other tune recommendations and workforce matters. You can see on the screen there the outline for the presentation. Shortly we'll go to that video, but as we then go through, I'll provide an overview of the context of the budget, look at some specific measures that have come out in the budget, discuss some of the issues that we think are arising and also some of the omissions. And then we'll go to a Q&A session, and you can use the function that's on your screen. It's Ask a Question button, where you type in your questions and Troy will be able to read through those and put them to me and hopefully do our best to be able to respond to our members. At the end of the Q&A session, we'll actually be doing a live web poll using the function again on your screen, where we'll ask a very straight question. Given the budget initiatives that have been announced for aged care, how do you believe that will impact your organisation? Will you be better off? Will there be no change? Or will you be worse off? And we'll be able to collate that information and use that as we progress with our advocacy with the government and others. And then we'll round the home straight. We'll talk about some next steps and take-home messages. So look, on that note, I'll get our control person here to play the video from the Minister Ken Wyatt. We'll hear what he has to say and then we'll launch into the presentation proper.
The More Choices for a Longer Life package flags a new era for older Australians. More choice, opportunity and certainty with a focus on helping people live independently for as long as they want. Aged care funding is at record levels and is set to increase by $5 billion. There's a rollout of an extra 20,000 high-level home care packages, with the number of high care packages rising to more than 74,000 over the next 4 years. During this time, the overall number of home care packages will rise from 84,000 to 151,000. Offer of new packages will begin to flow in the next few weeks to those who've been waiting longest on the queue. Clients will have 56 days to find a provider and begin the service. For those who are already receiving an interim package, upgrades will begin from the end of June. At the same time, residential aged care will also see record growth, with 13,500 new residential places and 775 restorative care places to be allocated this year, plus 60 million capital investment. Residents and their families can have confidence in aged care and the protection of their loved ones with the establishment of the new Aged Care Quality and Safety Commission, which will create an independent one-stop shop to ensure older Australians receive the best possible care. My Aged Care will be improved with an investment of $61.7 million to make it easier to use, along with simplifying the forms required to apply for aged care services. There'll be a $7.4 million trial of information hubs and personal navigators to help people choose the aged care services that suits their needs. Choice will also be made easier through a new 8.8 million user-friendly online aged care provider comparison system. The return to indexation of the majority of ACFI subsidies from the 1st of July 2018 will increase funding for providers. The government continues to support the rural and remote sector with the Viability Supplement, new capital grants and ACAR. The government has previously announced a review of the residential care funding system with a landmark study examining cost drivers in the sector currently underway. Once completed later this year, this will provide strong evidence base on which to consider funding issues in the sector. Please be assured that we will continue to consult closely with the sector in determining the direction of funding reform and ensuring all issues and views are properly considered. The More Choices for a Longer Life package responds to a number of the key findings and recommendations of the Tune Review. In addition, there are other initiatives recommended by the review that are already underway. These include the review of existing respite arrangements being undertaken by the Aged Care Financing Authority, and a range of initiatives to support the aged care workforce through the development of an industry-led aged care workforce strategy. We do not support Tune's recommendations 13 and 15, but we look forward to working and hearing from you, providers, about what you see as a truly sustainable aged care funding system. Regarding the opening of the next ACAR round, it is imminent and I expect to announce it shortly. Pre-announced information to support applicants to start planning for the upcoming ACAR is currently up on the department's website. Application forms, guidance and further information will be available on the department's website once I've announced the opening of the ACAR. In the meantime, I'll be opening a stakeholder consultation process next week to seek the views of people and organisations involved in aged care on where to locate those thousands of new residential aged care places. The government wants to provide greater choice for senior Australians and supports in principle a transition from the current allocation of residential care places through the ACAR as recommended by the Tune Review. However, this would be a significant change to the current arrangements, and it is important to fully understand the implications and risks, including the cost of alternative models, before making a final decision. We are funding an impact analysis in consultation with resident representatives, providers, the finance sector and other stakeholders. Everyone will have the opportunity to provide their views in the coming months. A key focus this year will also be the aged care workforce strategy, which I'm due to receive from the Workforce Task Force by the end of June. Professor John Pelares and the Task Force have been busy reaching out to those working within the aged care sector and senior Australians to obtain their views. Crucial to this is building capacity within the workforce and a strong focus on staff retention and career paths. The Task Force has already achieved much, with the formation of an industry reference committee to guide training and career development and an industry accord for the remote aged care workforce already underway. Regarding our decision to combine home care packages and residential care funding, I would ask you to focus on the outcomes rather than the process. What matters is that we are significantly increasing the number of both high-level home care packages and residential places. Budget estimates from last year and this show a reduction in yearly aged care demand of between 6,800 and 7,600 residential places, worth about $500 million a year. Combining the funding streams gives us a more responsive, flexible system, allowing funding to be allocated according to demand, better reflecting the preferences of older Australians. Dovetailing with this, we have ensured the Commonwealth funding allocated each year for aged care stays in aged care. Previously unused funding could be returned to consolidated revenue each year. From now on, it'll be retained and channelled into the areas of greatest need. Prudential requirements are changing too, but the system remains secure. The total pool of accommodation payments is $23 billion and growing. If an aged care provider becomes insolvent and is unable to refund the accommodation payment made by residents when they enter a residential aged care facility, the government guarantees the repayment of the funds. A compulsory retrospective levy on the non-government residential care service providers holding refundable accommodation payments will be introduced from 1 July 2019. However, the levy will only apply where defaults on the payment of accommodation deposits exceed $3 million in any fiscal year. Imposing a levy reduces financial risk for government and ensures a fairer sharing of costs associated with the government's guarantees scheme. In summary, the breadth of these reforms represents a significant milestone for aged care and ageing Australians. Our government is committed to working with providers to ensure ageing Australians receive the protection, support, care and respect they deserve, and together, when we work and walk together, we will make a difference in ensuring that senior Australians have choice, a guaranteed safety and a guaranteed access to care. Thank you and enjoy your deliberations.
So there you go. We've had a presentation there direct from the Minister, and I've got to say in post-budget times, it's very busy for MPs and ministers, and to have Minister Wyatt be able to produce that at a very early hour this morning and send that through, we very much appreciate him doing that on behalf of our members and being able to talk direct to industry. And you will note that there was a combination of just an overview of some of the key initiatives in the budget, but also responses to some of the specific issues that I know are already bubbling up through our membership base. So look, we'll go now formally into the presentation proper. And I thought the starting point really is to just look through some of the context and scene setting for this budget. So in our pre-budget advocacy and in our pitch to the Treasury, we said, look, aged care is a system that's under pressure and at serious risk because we're really caught up in the middle of this reform agenda that whether you're an older Australian, a provider of aged services or a government, we're all wrestling with the transformational change underway in the system. And the proof points of that pain and turbulence in the system is, as you would all be aware, residential care financial performance, the home care national queue, community confidence and questions around quality in our industry, and inadequate support systems in government. Our expectations were running high for this budget. Minister Hunt, back in the May 2017, when he presented the health budget to the industry, he said that aged care would be a priority for the 2018-19 budget, and Minister Wyatt all throughout the current financial year has been saying that responses to all the major reviews and recommendations would be addressed in this budget, which led us to question, would this be a reform Mark II? What we've ended up with, if we look at the formal sell, for want of a better term, from the government is this. Treasurer Scott Morrison, in his presentation of the budget on Tuesday evening, made specific reference to the ageing population, and I thought really importantly framed it around not so much a problem to be solved or a burden to be borne, but actually something to be celebrated and an opportunity for the country to get behind older Australians and support them to continue to age well, but also continue to contribute to their families, the communities and the economy. Minister Ken Wyatt, in his briefing to industry at the health portfolio budget lockup, spoke about, for aged care, really a budget that was framed around making aged care better. So he talks about better access to services, better quality of services, and overall an outcome around better ageing. And the headline number from Minister Wyatt was a $5 billion increase in funding over the next 5 years. And at the bottom of this slide, you'll see a cut and paste direct from the Health Department's portfolio budget statement, which talks specifically around aged care. So the big question for industry and all of us is, these times of years, you really are trying to work your way through, is it really, the next big thing for aged care and for older Australians, or do we end up with the smoke and mirrors that is often the catch cry at this time of year? So what we'll do now is move into looking at the budget specifically through a few lenses. So we'll look at residential care, what's in it for home care, what's in it for the wider reform agenda, and then also some other initiatives, not necessarily in the health portfolio, but would also have impact on older Australians and on our industry. Now, bear with me, there's quite a bit of detail to go through in this, but I think it's worth noting so everybody is across the key initiatives. So that the premier announcement with regards to residential aged care, you would have heard from the Minister and in media, is that the ACAR will be reconstituted in 1819 with 13,500 res care places, 775 short-term restorative places, and an additional 60 million for capital investment. If you look at that out over the out years, you'll see an increase in places from around just over 200,000 to close to 240,000. Now, you also heard Minister Wyatt at the video at the start of this saying that the announcement for a next ACAR round is imminent. The other funding commitments for residential care include $40 million over 5 years for infrastructure for organisations operating in rural, regional and remote areas. In discussions with the department, this will be realised through an ACAR-type round. There's also another, that will also be available for home care investments as well. The government has applied a $50 million funding over 2 years for res care services to support them transition to the new aged care quality standards. This was a direct budget ask and advocacy from LASA, and we're very pleased to see at least some relief for residential care providers. The mechanisms to actually realise that money out to res care providers is a work in progress, and we're still pursuing that with the department. Importantly, there's a funding pool for mental health services for people in residential aged care, noting that this was a particular gap that has been identified previously. And in addition to that, there's another $32 million over 4 years to support palliative care into residential care. Now, having said that, this seems to be contingent upon the state governments coming to the party, and that funding will flow through state government agencies, not direct to providers, but that still requires further discussion with government. And then there's an additional $105 million odd dollars for Aboriginal and Torres Strait Islander flexible care programs, which is obviously a key support mechanism for Indigenous Australians. If we look into the residential aged care reforms, the government has provided $8.8 million for a performance rating system for res care providers. Now this, basically the government has set a line in the sand that by 2020, they will publish through the My Aged Care portal comparable performance ratings of providers. Now this is a very strong message to our industry that the government is moving at pace with the introduction of the reform agenda around consumer choice. And I would suggest that the level of transparency that's going to be required will require significant co-design is our conversations with government at the moment, because we want to ensure that if there are measures out there, that they actually do make sense and are truly reflective of what clients would value, but also what providers think is appropriate given the complexities of some of the matters that we deal with. We've had a small win with regards to unannounced visits. You might recall previously the government had announced that as of 1 July this year, they would be charging a levy against all res care providers to cover the cost of unannounced visits. We've now been able to have that pushed back to 1 July 2020, and I'd suggest there is a question mark over that, because we also know that from 1 July 2018, there'll be the introduction of the unannounced reaccreditation visits. And I think working through that needs to be resolved before we can then deal with any other costs related to the normal unannounced visits. You also would have heard the Minister in the video earlier today talk about prudential reform. The bond guarantee scheme is growing, or the bond pool is growing, 23 billion. The bond guarantee scheme is still in place. In legislation, the government's always had the ability to bring in a retrospective levy, and the Minister has made a clear announcement with regards to that. There's a bit more detail to go with regards to other stronger prudential standards that the Minister mentioned, and we're working with government to understand exactly what they're considering there. There has been 2 reviews, one by ACFA and one by Ernst & Young, looking at all manner of different measures, be they balance sheet ratios, business structures and the like. So further work to do there. Consumer-directed care in ResCare. You might recall David Tune made a recommendation with regards to the deregulation of bed licences, a very contentious issue for an industry that's very capital intensive, obviously. And David Tune was quite clear that before the government even entertained the notion of deregulation, there were a number of preconditions that needed to be met. Now, the government has set aside a small amount of money to be able to do a high-level impact analysis of if they were to even entertain going down this path, what might it mean, not only for consumers but also for providers and the entire aged care system. There is further work to do. LASA will be advocating strongly with regards to the design of any impact analysis, and the conversations we've been involved in with government throughout the Tune review and the recommendations process is that this would need to be approached cautiously and with a long-term view to ensure that any changes would make sure there was appropriate structural adjustment in place to protect not only consumers but also providers. You might have also realised in Minister Wyatt's opening comments there has been a change to the way the government's internal budget accounting processes have been applied to this budget. So as of 1 July, the government will now pool the funding in the budget statements for home care packages and residential care packages into a single bucket of funds. Now, what that does do is, as Minister Wyatt suggested, it does give government greater flexibility for the way that they can utilise those funds in response to demand. But what we've gone to government is sought assurance that this does not change the residential care and home care places target, which is 125 places per 1,000 people in the population over the age of 70. That's to be achieved by 2022. And importantly, that it also doesn't change the ratio or the relative mix between home care, restorative care and residential care. And advice from government is that there has been no change to either the target or that mix of places. So now if we look at a home care, we'll see here that, again, one of the premier jewels in the crown for the budget in the way that the government has articulated is that there's now more than 14,000 home care packages that will be funded in this budget over the 4 years. They hasten to add that that's on top of the 6,000 packages that were released in the second half of 2017. This speaks directly to Tune recommendation number 5. So if you look at what that means in absolute terms, that by 2021-22, there'll be more than 74,000 high-level home care packages in the system, and that is a significant increase. And it's a significant price tag of $1.6 billion over 4 years. Now, interestingly enough, if you look on the slide, the department talks about a change in allocation rates of home care packages. And so we're still trying to seek some further information around what allocation actually means, given that those numbers are quite high with regards to what an allocation number is. So whether that's an actual package or not, that remains to be determined. So we're waiting for government to come back on that. The other thing to note in home care, there is a significant amount of money which is going to be made available to RASs and also CHSP providers, which will support greater independence, mobility and autonomy for people in their homes. And this speaks directly to a Tune recommendation around being able to support wellness and reablement for older Australians in their homes. And so having that funding available at the, the early stage of people's journey in the aged care system hopefully will provide greater outcomes for older Australians and also delay their need for further care and support that would be more expensive. If we now move into looking at some of the key announcements with regards to the reform agenda, The government has made an announcement and responds to Tune recommendation number 27 of a new framework for streamlined and faster consumer assessments for all aged care services. And importantly, that would see over time a unification of the RAS and the ACAT workforces. Now that will play out to 2020, and that's a good outcome for consumers, as we know that the ability to be able to access services, there are inefficiencies and complexities in the system. There was also a proposal that was put forward by Tune for aged care system navigators. So these are the people that can actually hold the hand of people trying to access services and help them navigate their way through the system. This includes outreach services and other programs. There's a mix of different initiatives that will be trialled. There's a cost of $7 million over 2 years. But again, this is a way to support consumer choice, consumer-directed care in a challenging time for the families, but also for a complex aged care system. The government is also putting a significant investment, $61 million over a number of years, into the My Aged Care system. Now, this speaks to a number of the Tune recommendations, but importantly, I think it's now, recommitting the government to the importance of the My Aged Care system, not just the website or the call centre, but all the other elements that sit from a consumer and provider perspective, both in front of the screen and behind the screen, to be able to support efficient and effective transaction, for want of a better term, between consumers and providers. And interestingly, there was a sidebar note in the budget statements around a forms task force, which would look to simplify some of the means testing arrangements for consumers that have straightforward financial affairs. So what I think we'll see is a two-track process for the means testing. If it's relatively simple, it'll be fast-tracked through a particular new system or process, whereas more complex ones would have to still go through the usual mechanisms. You also heard Minister Wyatt in his opening comments talk about quality and safety, and there's been some media announcements pre-budget with regards to the establishment of the Aged Care Quality and Safety Commission. This will commence from 1 January 2019, and the government says it'll have no fiscal impact on the budget, given that it'll draw together existing agencies and areas of the Department of Health. That speaks directly to Carnell-Paterson recommendations 1 and 10. There's also a significant amount of money over the next 4 years for system upgrades and processes around risk profiling to support the new commission to better identify risks and respond quickly where they need to. And the government has also put aside $22 million over 4 years for a national plan on elder abuse, and in part this was a recommendation from Carnell-Paterson that linked to the Australian Law Reform Commission's report on elder abuse. So that gives some of the key initiatives in the budget that were announced through the health portfolio. There's a couple of other measures that are also worth noting for people in our industry. The government's going to invest significantly to stabilise and consolidate the health and aged care payment system. Again, this is an area of significant pain for our industry over a long period of time, and an area that LASA has advocated quite strongly and loudly on. So we welcome the initial investment. However, we're also still working behind the scenes to ensure that aged care is seen as a priority in that process. The government's going to invest $150 million in a medical research future fund, and I think importantly for our industry, a component of that is $18 million to keep Australians out of hospital where they're not, where we can reduce avoidable hospitalisations. And I know a number of our members work with their local hospitals and primary health networks in any number of innovative and interesting ways to realise those outcomes. But here's a significant amount of money now that will be made available to industry to upscale some of those initiatives. And then finally, with regards to people with dementia, there's also some further funding to support some technological solutions to enable them to be able to manage their conditions and manage their care better. I thought it was interesting listening to Minister Hunt in his presentation to industry on budget night and then also again yesterday morning at Parliament House. One of the key commitments in this government's budget is a rural health package. One of the core elements of that is a program to teach, train and retain 3,000 doctors and 3,000 nurses in rural areas, and LASA members that are operating in rural, regional and remote areas would certainly welcome that. There's also money to uptake a trial to support strategies to help people stay independent for longer, and a significant amount of money for carer support services. Now, we know many of our members also are recipients of government funding for carer support services, and there's reform underway there to come up with a nationally consistent delivery model via the regional delivery partners that currently exist. The pension loan scheme you also might have heard discussed in the media. This is an interesting one that will support older Australians to enable them to borrow against the value of their home to fund their care and other needs. So it does give an opportunity for people to access home equity underwritten by the government. And then there's and finally a significant announcement to support a national housing and homelessness agreement, which would be updated and having funding matched by state and territory governments. And again, a number of our members work with seniors housing and social housing. And so having a reboot of the agreement would certainly be of benefit. So that gives, as I said, quite a detailed dive into, I guess, some of the headline announcements in the budget. But I'd like to share with you some of the omissions or issues that arise. Firstly and foremostly, for anybody that's operating a residential care facility, it's writ large in our advocacy over the last 12 or 18 months that there is a funding problem in the system. And notwithstanding our best efforts, there was not an adequate response to deal with the short-term funding relief required for residential aged care facilities. Again, one of the other things we were looking for was an increase in the rural, regional and remote viability supplement to ensure ongoing provision of services in regional settings. Notwithstanding there's some money for capital upgrades and maintenance, we still think there was more work to be done there. Interestingly enough, we did a reconciliation between the budget initiatives and the Tune Review, 38 recommendations. In the Tune Review, we think probably somewhere less than half of those have been responded to in the budget. And we note Minister Wyatt's comments. So some of the notable omissions there is consumer contributions, the price comparison in home care, which was a couple of recommendations in David Tune's review, and also workforce, I think was a glaring omission, notwithstanding the Minister's comments that we're still waiting to see the output of the aged care workforce strategy task force. And then the long-term strategy to address the core underpinnings of our system that David Tune said needed to be addressed. And specifically, the planning for growth is one of the biggest changes for the industry and for government. And at the moment, we haven't got the system settings right. And notwithstanding that, with those system settings, the additional investment that's required by government is currently beyond what is currently planned by the government. And then the key issue is how we actually finance that and share those costs between the government and consumers. So look, I've gone into some detail there, Troy. I hope our members have been able to get some value there. And I think what we'll do is stop and see if we can take a breath and respond to a few questions or comments from our audience.
No, you've done really well to just give our audience an opportunity to really see in a quick amount of time the detail behind the initial announcements for the budget. What I want to encourage our participants now to do is to use the tab Ask a Question. Now's the right time to put those questions forward. We'll do our best. Sean as the CEO, myself, Troy Spears as the Principal Advisor for Home Care with LASA. There's an opportunity now really to get into a conversation with us both here in the same room. That doesn't happen too often. So, and really start to look at what does it mean for your business in moving forward in the next couple of years, and then past 2020, moving forward beyond in terms of the way the transformation process is going and the way the budget signals where we're actually going. So I'll start off with the first question put forward early in this morning's presentation, a question about the indexation of increasing in fund rates from 1 July 2018. Will there be an increase in indexation rates?
Look, good question. It was interesting. I picked that up too in the Minister's comment. I think what he said was that there'll be a return to indexation in ACFI. Now, I have to go back over to get the video to get the specific response, because I think what he said in components of the ACFI rather than the ACFI as a whole. So we'll take that one on notice, but we do know that there is has been a pause on ACFI. I'd also say that I was in correspondence with the Minister's office and also the department this morning to get an update on COPE payments and what percentage has been set. I got advice back from the department is that they can say that the percentage has been set is greater than 1%, but they couldn't be more specific than that. So that's still a work in progress, but just know that that is the official line from the department at present. And with regards to the ACFI, we'll follow up with the Minister to get clarification on his comment.
Okay, thanks, Sean. The other question that's starting to pop up is around the 1,400 new home care packages for higher level care. Can you give a bit of a comment regarding what that's going to mean for providers in regards to the nature of the way packages currently operate? We know that there's a lot of packages in the lower levels. We know people have often geared their systems to that kind of care. What's the kind of changes we can expect with an increasing number of higher level home care packages? What's it going to mean for the operations of home care providers?
That's another good question, and I think it's fair to say what we're seeing is the rubber hitting the road with regards to the reform agenda. You know, ageing in place is absolutely the writ large as the key driver and key principle around the reform agenda, and then behind that we have consumer contributions and a market-based competition and consumer choice. But this, I guess, transition to an increase in the higher level home care packages, I think really is a demonstration of the government's commitment to ageing in place. What that means for providers, I think it depends on how you've geared your current operations. You know, I think it's fair to say we know there's a lot of turbulence in what is reasonably an immature market in home care, given the changes from late February in 2017. We've seen, you know, a 60% increase in the number of providers. So we've gone from around 500 providers in home care to around over 800. What we've also seen is small increases in the number of packages. I'm not sure how many 14,000 packages over the next 4 years, you know, how that's going to play out. I would argue when you've got a wait list of over 100,000 people, a lot of the commentary's been around 14,000 doesn't seem to be a lot in order to meet that demand. So I think more work to be done, as I've said earlier. But maybe you might have some commentary given your role as our principal advisor for home care.
I was only looking at the latest home care package data report this morning. So level 3, level 4 packages, that's where these 14,000 new are intended to be allocated. And the Minister said starting in the next few weeks, we're at 20,000 home care packages in the system, active with compliance on level 3 and level 4 as of September last year. It's probably increased a little bit since then, noting that those 6,000 higher level home care packages were brought in since that data was identified. So we've probably gone a little bit higher. And what the budget announcement has said, 86% increase on that to 74,000 in the next 4 years. So as you said, hit the road running? Absolutely. Those providers that have traditionally provided level 3 and level 4 packages who do complex care in the home well, you're well positioned. But those that have not traditionally done that, perhaps more geared towards the entry level care, the lower level care packages, there's some key indications in this that you need to start looking at business development and risk management to be able to allow your workforce to follow the consumers into that complex care space and make sure you have the clinical governance and clinical oversight to really do it well. So when it comes to that time, you're not going to be competing in terms of the quality or the intensity of support you're providing with other providers who have more clinical governance structures in place. So I think this is going to sort out the riffraff in terms of those new providers and those established providers who can provide continuous care. If I were an older person and when I come into the system, I want a few people who consistently come into my home, who I can have a relationship, and I want them to stay with me, just like my family stays with me. And that's the way we need to be thinking about it. So when I think about workforce, and NDIS is going through a huge growth in workforce, the challenge is how do we keep our good staff to be able to provide that continuous care?
Yep.
So really important considerations in the immediate future for people in terms of business operations.
And I think I'd add to that, in the medium term, so we are seeing that continuum of care model, and everybody online would know that the industry we're in is a relationship industry, and so having that relationship settled at the start and then being able to carry that through as people's care needs change, I think really important. But then also to note in the medium term that the HCP amalgamation in 2020, that's also, if you're not thinking about that now and you're in that business, you probably better start thinking about it.
Yeah. And the other thing I think about, Sean, as well is the government with the changes to the personal loan scheme are really signalling, the way forward with increasing consumer contributions. With an election coming, I've seen some comment regarding it'll probably happen after the election. So I think the challenge really now is for providers is how to really engage with consumers around that issue of contributions. And I know LASA's got some master's classes coming up on selling home care that our audience should be aware of. I just wonder if you want to comment there more about that dynamic of a maturing consumer market towards contribution and the challenges that might create.
That's a really useful observation, because what I found interesting was the government in the Treasurer, from the Treasurer down, talking about the ageing of our country. And that's something that we haven't heard previously. And so my view is that now we've been arguing that ageing is an issue of national importance. It's now on the record and on the radar as something that the government's starting to turn their mind to. You're right on the money about the consumer contributions piece. I mean, I think, as a personal view, any government, we know this was a pre-election budget. I don't think any, sitting government would look to bring in those types of changes in a pre-election budget. But there is further work underway, as Minister Wyatt mentioned, and I've been telling our members, we're doing work behind the scenes to get bipartisan support for consumer contributions, because it doesn't matter which side of the political divide you sit on, you can see the ageing of the population, you can see the growing cost to the taxpayer or to the federal budget, you can see reducing incomings with regards to that. So the only way to fund the system is to find contributions from other places. And so there is a component part around consumer contributions, but we've also been calling, as you know, for that a national strategy that would give a sustainable funding strategy for our industry. And this needs to really explore all the big opportunities and the big ideas that are happening in other countries that are dealing with similar things. So whether it be they tax concessions or levies. It was interesting, Paul Keating was on Four Corners recently talking about a longevity levy as a way to look to be able to fund people's care and requirements into their older age. So more work in progress, I'd suggest.
Okay. And the other thing with the home care package is, do we have any information around the split of those 14,000 in those higher levels? Is there any detail regarding rollout?
Not as yet.
No. So it's more watch this space.
Well, and know that we have put forward to government a comprehensive, what we've colloquially called the Please Explain document, which is, great, you've made all these announcements and initiatives, but there's a whole lot of detail that we need to understand. So can we please get that? That's now formally in the system, so as soon as we get responses, we'll be sharing that with our members.
The other thing I think that's interesting to note in the budget is the amount of money that's been invested into My Aged Care, 61.7 million. And with that, we've seen a little bit of media attention around outcomes for consumers. We know if we're going to, as an industry and as a government, encourage consumers to contribute more to the cost of care, and develop an expectation that that's what they're going to have to do for us to have a financially sustainable model. I guess the key issue for the consumer is understanding the value of what it is they're purchasing.
Yeah.
And I think I'm getting indications from the way the government's and some of these announcements that it's really about my aged care and the way it communicates value. And I'm just wondering, what's the implications then for home care and resi care providers or aged care operators around the next couple of years if we're going to see the government really ramp up my aged care and create greater visibility and transparency?
Yeah, look, that's an interesting observation. You're right. I mean, the reform principles are based on choice, and with choice comes, being able to assess relative value. And when people are having to pay more, that becomes, a more sharpened level of scrutiny. So, it's in that context that we do know that the My Aged Care system is the premier tool from government to be able to support people to make choice and then connect supply with demand. So I think you're reading it well. $60 odd million over a few years is quite a significant investment into that system. And it is about being able to build the confidence and the capacity of the consumer to make an informed choice. For providers, what that means is transparency around what you're offering and being able to clearly articulate the value that your service provides to a consumer.
Yeah. The other thing I think about with that, Sean, it really ties into good leadership, the whole idea of understanding your business development over the short term and also your risk management frameworks.
Yeah,
what are the key risks that might end up in that My Aged Care space that you need to get right pretty quickly?
Yeah, and I think even beyond the My Aged Care space, members that participated in the State of the Industry briefings that I did, one of the key take-home messages was, the rise of the consumer. If we think that, the system is going to continue to just play out as it has traditionally, those days are gone. People are out there having to pay more money for services. They're going to have greater expectations around what they receive. That plus the fact that we're now transitioning between the builder generation to the boomer generation and their different set of needs and expectations and desires around what constitutes good service, that's basically forcing a transformation in the way that providers are having to meet those needs.
Great. I'm just going to go to one more question in the home care space and then try to follow through with a bit more around resi care for our audience that are in that space. One of the questions we had earlier from the week from one of our LASA members was around in the budget data, they talked about allocated places over the next 4 years, and then they talked about the actual 14,000. I wonder if you can make a comment. Do you have any information around understanding those allocated places? I can answer it, but I'll put it to you.
Yeah, well, you know the response, so I'll let you deal with it.
Okay. So just setting that question, but answering it myself anyhow. We went back to government after the budget announcements to get some more detail, and I note that it said that in 2018 there were about 87,000 allocated places, which will increase to 151,000 allocated places over the next 4 years. But when we look at the home care package data and the releases, you're looking at about 150,000 a year.
Yeah.
Now, the response from the government is very much acknowledging that the length of stay on those higher level packages is about 12 to 13 months. So there's going to be some clients that in any 12-month period will come through and exit a package. So we're going to see double counting in those 12 years. So the 87,000 is really around the new allocations, that new releases that are coming through, not repeat releases. So I think what we're going to see is that 87 is the actual number of new releases, where there's a lot of churn in that 150,000. Now, the complexity of the detail in the home care package data report doesn't reveal that, and it makes it very hard for us to interpret. So I think the point you've always made to me is that we need to get home care package data that has greater depth of detail and more timely. And this is something we've been advocating for to help us in our business planning.
Yeah, absolutely.
Yeah. Okay, moving on to resi care. Is there any guidance on the 13,500 residential places in terms of how they'll be allocated, state percentages, for example?
No, is the short answer. Minister White had made comment both today and previously that there was a review of the guidelines for the ACAR following the last round. There was some commentary in the Senate that caused the government to come back and do a review of the guidelines. That's been conducted. It's interesting that there's 13,500 places are going to be released imminently, according to the Minister. But I think interestingly too, you did also note a bucket of funds that will be available for rural and regional providers for an ACAR or ACAR type round as well. So that would suggest that there is some empathy for providers in non-metro areas. So there'll be some opportunities for them there outside of the normal ACAR round. But with regards to those 13,500, no indication as yet with regards to priority areas, though I did note the Minister did suggest that having a look on the department's website in order to kind of front load your applications would be a useful thing to be doing.
Yeah. And then the other really challenging question, but important question is, given, that the industry knows there needs to be another 83,000 beds in the next decade, costing around $35 billion. The budget's not giving any indication in how they're going to respond to this. Losses as well in the last financial year reported. How are we going to work to respond to this as a sector and really, work with government to address the issue?
Yeah, look, I mean, I think if you haven't picked up the theme that I've been trying to articulate with regards to some of the omissions and the gaps in the budget, notwithstanding high expectation that we had with regards to a response to all the reviews that have been going on, what we find is a measured response, some good news, but obviously more work to be done. Particularly around residential care, we know that Stuart Brown reported in their last financial performance survey, as at the end of December, they're seeing around 41% of res care facilities recording financial losses. And that is just unsustainable in anyone's terminology, and that's on the back of ACFA reporting around a third of providers over the past couple of financial years has been recording losses. So you've got an industry or a sector of the industry that's struggling in terms of its financial performance. We've got demand rising, we've got consumer contributions stable, but no ability for providers as yet to actually increase those contributions. You've had the government take $3 billion of funding out of the system, or successive governments take that out of the system over time. And all the while, demand is growing, and we've got government also reporting we need $35 billion worth of investment. There's something that doesn't add up there. And, the work that we're doing is very much around coming up with a sustainable funding strategy that will deal with that. And that's got to be in stages. So, as I said, there was some joy, although not enough response from government in this budget to deal with the immediate financial pressures. The next step is to work with both sides of the parliament around the Tune recommendations for consumer contributions. In parallel to that, progressing with a conversation and coming up with a strategy that secures funding for the industry for the next 2 decades to deal with that big bubble of the baby boomers, rather than continuing to have to, tinker at the edges of ACFI scores or, indexation payments. So, they're on the money. That is the big issue for residential care providers.
Yeah, okay. And then the other thing got a question here about is, when do you think the performance rating tool will be available on the MAC portal, if we're going to see 2020 as a release date for that?
Yeah, the performance rating tool is an interesting one. I mean, it was a Carnell-Paterson recommendation that they specifically referenced the UK model, which is a star rating system. In consultation with our members, we formally responded to government with regards to those recommendations and said it's far too blunt an instrument, it's far too simpler approach. A simple star rating system is not going to add value to the consumer or to the provider. Government has come out and said, okay, we hear you. We're going to put in place some type of system that's going to be able to provide comparative analysis with regards to compliance with quality and safety standards, and we'll work with industry and the consumer groups to be able to work out what would be an appropriate mechanism to do that. So, like most things, they've made the announcement, they've set a timetable. Now the task is to work together to be able to realise something that works for everyone in the system.
The other thing I note in that, Sean, is that they've also been in the moment developing the consumer experience reports for home care as well. So the whole idea of outcomes in home care as well as outcomes in resi care, they're on the table. We've got a time frame, July 2020 for resi care. So home care's sort of lining up in the same direction. And then the other thing that's on the table is the price comparability. We've really seen that in the home care space and consumers with price sensitivity. You know, I recall a consumer giving me a call asking about how they become an approved provider to get more money. You know, that's the maturity of the consumer market at the moment. That's the intensity of price sensitivity. And the government's now starting to give indications of greater comparability around price, and then by July 2020 around outcomes. It just, all the balls are lining up on the table.
Yeah, I mean, home care providers would be aware of the work that we did engaging with them just recently with regards to the government's desire for price comparability in home care packages and different ways to be able to achieve that. It was a David Tune review recommendation. Interestingly enough, we anticipated the government would respond to that in the budget, and they haven't. But you know, we advocated strongly on behalf of our members with regards to their views around what's an appropriate way to bring that level of transparency around pricing to what is an immature market, and not being overly constrained or overly regulated whilst that market does you know, find its equilibrium.
Yeah, and then the other thing I think about there is the visibility of the personal loan scheme. You know, we're wanting to encourage consumers to understand the value, but with that we're also wanting to encourage them to contribute. I don't think the issue of unmet needs is going to go away. The demand's always going to be greater than supply. It's really about those higher level packages getting to those who are most vulnerable and needing them, but other people contributing to out of their own funds. So when do you think that information that we can start to engage with consumers and the public around contributions and expectations will come to fruition?
Look, I mean, I think in part, getting back to my comments about the Treasurer's comments around an ageing Australia, I think that conversation is starting. So that's a good thing. Interestingly enough, I think anybody who's been engaged with John Polaires and the Aged Care Workforce Task Force, that the first initiative that they're talking about in that strategy is reframing in the minds of our industry, but importantly in the minds of Australian communities, the role that aged services, aged care plays, and reframing that around why we do what we do and why it's important. And I think, again, that type of social campaign brings forward the value of what we do. And so I think those two things, and thirdly, the work that we've been doing and will look to continue to pursue now with government and some of the consumer peaks around ageing in Australia rather than just aged care. So as you know, we've reached the new normal with the number of people over the age of 65 and 85. This is a good thing. But what we're seeing is these spot fire conversations around elder abuse, around ageism, around retirement incomes, intergenerational equity, et cetera, et cetera. Having that conversation with the community to understand how do we wrap ourselves around the growing number of older Australians in a way that enables them to continue to age well, getting that conversation right, and then saying, well, if that's the case, this is how we now meet your needs when you require care, support, services and accommodation. And this is the expectation you have of us, but we have of you, I think is part of the solution.
Okay. So Sean, we've had a bit of a conversation now around home care, resi care, my aged care. We also know the single aged care assessment workforce and the integration that's on the table. That'll align with the my aged care. The other key question now is around the government has shifted from home care being separate from resi care and starting to put it all into the single line item. And then the other recommendation, which is the other budget line item, which is critical, is the impact analysis for the whole idea of combining packages and residential aged care. I'm just wondering whether you want to comment or you have a view around that impact analysis and the way that's going to to play out over the next few years?
Look, I think just getting back to the point about the pooling of the funds between home care and res care, if you go back to my earlier slide around smoke and mirrors, I think what needs to be understood here is that the government has, played a role here in pooling funds that, if they had have been unspent, would have been returned to consolidated revenue. And the Minister made comment about that earlier in his video presentation. So what that does is actually secure funds that would have otherwise been lost to the system. It actually secures them in the system. That's a good thing. And I think the other thing to note is that we've pushed the government to ensure that the ratios, so the current target in number of subsidised places and the mix of those subsidised places remains solid to what they've currently planned. So I think that's probably the focus there. The impact analysis piece will flow, I guess. We'll have to wait to see more detail on that.
Great. Okay, and then just a couple of other comments. I'm getting some questions here around detail.
Yeah.
Like a lot of what we've talked about is still relatively broad. Is there more detail? What do we expect is going to happen over the next couple of months in trying to give our members the detail they're looking for to understand what's going forward?
Yeah, look, maybe we'll hold fire on that one, given that there's a couple of slides to come around next steps.
Okay.
And also some take-home messages.
Okay. Well, we've been doing question time now for about half an hour. We have a poll that's coming up now. So we're just going to ask our administrator for the webcast to put the poll up now, if that's possible. So what we're actually polling you now about, and noting that there were questions there that we haven't got to answer, but we will continue to invest time to communicate out to members ongoing around the detail as it comes to hand. What do you think the impact of the aged care budget will have on your organisation? So if you can just take your time now to answer that. There's three options: positive impact, no impact, or negative impact. And what we'll do is you take your time to think about that and answer that question. I'm going to hand it back to Sean now to just follow through with where to from here.
Great. So thanks, Troy. So look, while you're filling in that polling question, just looking forward. So look, we'll continue to consult with our members on the key issues arising. As I referred to earlier, we've pulled together quite a comprehensive document, which we've called colloquially the Please Explain document, which really just goes to the government. So you've said all these initiatives, that's great, you've articulated what it is. But the real question for industry and for us is, well, how do we go about realising the outcomes that you're seeking, but also accessing the funding that is the mechanism to realise those outcomes? We'll continue to work, obviously, with the Minister and the Department, and also the other side of the House, to deal with some of those co-design issues that will be required. And I've mentioned things like the ratings scheme for performance ratings for providers is one of those where there's a lot of heavy lifting to go before we get that settled. And as I mentioned earlier, progress in advocating a sustainable funding strategy for the industry. And this picks up on the David Tune recommendations that have been omitted in the budget and response from government. I think the other things just to note, looking forward, so my EFO, much as the budget's only still warm, my EFO will play out in December. This is the mid-year economic forecast. Particularly focus there will be around financial relief for residential care providers. I'd suggest that we will have more evidence for government to consider with regards to the financial performance of providers, and we'll continue to seek relief for those providers that are having financial difficulties with that combination of a reducing or a flatlining revenue line from subsidies, but ongoing increasing costs. We'll continue to work at the parliamentary level to be able to influence some of those decisions. The Workforce Task Force, we're working closely with John Polaires and that crew around supporting the thinking that's going on, but then really importantly being able to translate that thinking into some action and tangible outcomes for industry, and meeting with some of the key players there next week to discuss how we might pursue that. And then, of course, in all the public discourse and policy advocacy going around at the moment with regards to aged care, our role is to lead that as much as possible, but also to contribute evidence and balance to those conversations. And I guess if it wasn't clear before the budget, I think it's clear now. It's very much a federal election. We're moving into that time right now. I think if you saw Bill Shorten last night, he's made a very clear pitch to the electorate and clearly differentiated the ALP's offer to the coalition's offer. So working to come up with a game plan with our members in how we seek to influence some of the policy thinking and some of the advocacy through an election process is front of mind. So look, I might just leave you with some take-home messages. So in summary, look, my view is, and the view of our members is that, look, there's a few steps in the right direction here, and I think there's a couple of headline things to note. Ageing, as we have argued, is an issue of national importance. We've been saying that for some time now, and it's good to see the government now responding to that at the highest levels. What we also see in this budget is there a significant focus on consumer supports that will enable better access to be able to access services through both the amount of services available, but also the systems and processes that support them to make informed decisions. And equally importantly, more services. So access to services in the bush, dementia care, palliative care, et cetera, et cetera. I've also said an increased spend on aged care with a question mark, because I think, getting back to that comment about smoke and mirrors, that there is some uncertainty around, is there actually new money, more money going into the system? And I think that's something that we're continuing to press government on to be able to understand that better. But, and I think this is the big but, there is much more work to do. As I've said previously, the financial sustainability concerns remain for a number of our residential care providers. Speaking directly to a comment that Troy referred off the feedback from the participants in this, there is a lack of detail on the delivery of the initiatives. And really importantly, one of the focuses that we have in that is, what is the potential additional cost to business when we're looking at some of these initiatives? And where is the cost-benefit analysis, and where's the reduction of red tape whilst the government wants to come up with new things and new ways of doing things? Support for the workforce was noticeably absent. I've commented on that. And really taking the step back, this budget does not provide the system settings that is going to meet growing demand. And so a long-term strategy to progress the reform agenda still needs to be worked through in order to realise the outcomes that have been set in train that will respond to the growing number of older Australians to be able to meet their needs effectively. And that can only be done through an accessible, affordable, quality care and services delivered by a high-performing, respected and sustainable aged services industry. And so that's very much, I guess, our mission as your peak body is to be able to pursue that on behalf of you. And so you'll see on the screen now my email address there. I thank you very much for your support. Any questions or comments, please don't hesitate to email me directly. And I'll throw back to you, Troy.
Thanks, Sean. So there we have it. The LASA's official in-depth analysis of the 2018-2019 federal budget. And as Sean has said, the scene's now set in the lead up to an election, and there's plenty of work to be done. So we're here to work with you. We know there's a lot of expertise, good policy position from a credible industry. We just now need to navigate that political landscape in the future years. We have good indicators on where the budget's going, and we now need to try and leverage off that environment. Feedback for you in regards to what you, as the audience, think about what the budget means for you and your organisation. Well, about 2/3 of the participants have responded, so we have a good sample there, about 100 plus. 50% of you think it's going to be good for you. So that's where you're currently at now, a few days out of budget. Bit more detail comes out, that might change again. 30%, not so good. You know, big concerns around what it's going to mean for business. And then there's about 20% that have no impact. So Sean, any comments around that in regards to speaking to the audience around perception?
Look, thanks very much for participating in the poll, and if you haven't done so, please do. It gives us great feedback and insight, and in particular, I'll be talking with the Minister's Chief of Staff this afternoon, and I did tell them that we were going to poll our audience and be able to provide some direct feedback. So please, if you haven't already used the poll function, please do. Look, I got to say, I'm a little surprised. 50% would say that things are going to improve. I think we've got it right to a degree to say it's a step in the right direction.
Yeah.
But we've still got the other 50% saying it's either going to be worse or no change. Yeah. And to be honest, that's not good enough. You know, what we need is an industry that's actually stable, secure and confident in the future, rather than going, well, half of us think it's going to be a bit better, but the other half aren't.
Sean, I just look at the amount of advocacy work we've been doing in the last 12 months, particularly around that home care space with increasing choice in home care coming through. And I think as an industry, we've done really well. What we've done is we've seen a budget that's shifted money, not so much added money, but shifted money into those key areas that need to have. We've got wellness and reablement. We've got system navigation. We've got palliation in the home. From a home care perspective, there's some things there. But what we're seeing now is that combining of home care and resi care means we now need to articulate even further the continuity of care as a client transitions from age in place, but realises the value of residential care as an extension of that.
Yeah. Look, I appreciate your comments there, and I think you're right up to a point. What we've impressed upon the government in the last 12 months with regards to funding and budget, we know that the pain point for government politically had been around the home care wait list. But we said, look, yes, you've got to solve that, but you cannot solve that either to the expense of residential aged care or the exclusion of residential aged care. And what we're not seeing in this budget is an appropriate and adequate response to deal with that short-term financial pain, and then the longer-term system settings, whether it be in res care, home care, CHSP, in order to get the system right to be able to meet that change in current demand and growth in future demand.
Yeah. Okay. Well, that's it from us, everyone. We just want to thank you now for your joining us for this webinar. I'm sure there'll be follow-up questions from individual audience participants to come, and we'll develop a communication strategy as we continue to have information come to hand from government as the budget and the policy implications of the funding moving forward start to unwind. So thank you.
Thank you very much.